Friends, being concerned about COVID-19 is understandable, but for some people, it can lead to mental health issues. For the same reason, World Health Organization has come up with a guideline which talk about less consumption of news and assisting each other, among many other things. Uh, to talk on this issue, we have today with us Dr. Sourmitra Pathare. He is a psychiatrist and also director of Center for Mental Health and Law Policy, ILS Pune. Dr. Sourmitra, welcome to the show.
Thank you.
Dr. Sourmitra, what should people do who are now confined in four walls of their home, that too with an entirely different lifestyle?
Well, I think it depends on who you are talking of when you talk about people who are confined. Some people are going to be extremely vulnerable, and others not so vulnerable. So let's talk about people who are more vulnerable. People who have a mental health problem or have had a mental health problem in the past. People who are already taking treatment for some mental health conditions. They're probably the most vulnerable people. They are the ones who really need to be looking after their mental health situation. And for people like that, my advice really would be continue your treatment, stay in touch with your existing healthcare provider, whether that is a psychiatrist or a psychologist or a counselor or all of them. If you feel that your symptoms are getting worse or you're feeling worse than what you were before this COVID crisis started, then please do contact your psychiatrist or psychologist or a counselor and have a word with them whether you need some changes to your treatment. If you're on any medicines for your mental health problem, then please continue your medicines. Don't stop your medicines. That's probably the most important piece of advice for people who are already under treatment. The next vulnerable group of people obviously are people who may have been quarantined because of the COVID crisis. And in those people, some of the things that they are likely to face is the anxiety, because you don't know whether you're going to become ill or you're not going to become ill. How long will you need to stay in quarantine? Will you need to be hospitalized? Now, these are genuine and real anxieties. And you can look, your quarantine means you're physically separated from people. Quarantine does not mean that you have to be socially or emotionally separated from people. So there is no reason why, if you're quarantined, you cannot talk to your relatives, or you cannot talk to your family members, or you cannot talk to your friends. You can certainly, even during quarantine, use a phone and do all of that. If that does not help, then certainly you can talk to helplines. There are a lot of helplines which are available now, free helplines set up by NGOs as well as by governments, which you can call up and seek assistance from. And obviously, the other thing that you can do when you're in quarantine is to really look after yourself. And looking after yourself is simple things to do, which is maintain a daily routine. Even if you're in quarantine, try and have a proper exercise regime. Try and do things that will help you to relax. That might be just some relaxation techniques that you might have to try. And the most important thing is, don't have non-stop consumption of news, either from television or from media or from social media particularly. If you're getting information from somewhere which appears scary, then please double check that information. Be sure that the information you're getting is actually true and not just some fake news or people spreading some random rumors. So those are things that people in quarantine need to do. And for the rest of us, I think the most important thing to remember is that most of us are actually going to do quite well. You know, all of us have lots of reserves and ability to cope. There have been difficult circumstances in the past when we've actually managed to do very well. So many of us, or almost all of us, are actually going to cope very well. Unfortunately, some of us might have feelings of anxiety, fearfulness, depression. You might be afraid of what's the future for your children, what's going to happen about your job. And these are pretty understandable and normal anxieties. What is very important in such situations is actually to try and break up these anxieties down and ask yourself, what are things that I can do about this and what are things that I cannot do about? Things that are not out of your control, worrying about them is not actually helping. But things that are in your control and doing something about them is actually a much more productive way about going about it. And also just general stuff that you need to do. Like I said, to anyone in quarantine, even all of us need to maintain routines. It's a good thing to keep your daily routine, to try and get up at a particular time and do the work that you were planning to do, and to go to bed at the right time. uh, avoiding uh, avoiding short-term anxiety relieving measures such as alcohol or smoking is probably not the best thing to do. You're probably better off avoiding these kind of solutions.
But so many
And
people
the
are
most
actually
important
looking
thing to
forward.
reduce a lot of this.
So many people are actually looking forward to have alcohol.
Sorry.
Yeah, they,
I don't think it's such a great idea. I don't think alcohol is going to reduce anybody's anxiety. It gives some temporary relief and then it'll make things worse for you. So if you're feeling miserable, please do not drink. If you're feeling wonderful and you have a drink, that's fine. But when you drink when you're miserable, it only ends up making you more miserable. Just like when you drink, if you are feeling wonderful, it makes you feel even more cheerful. Alcohol is a very funny kind of a thing, and that's what happens. I also think that it's important. The most important thing is to maintain social contact. So, talk to your family, talk to your friends, be in contact with people. I think that's probably the most important advice for all of us who are stuck in this particular situation where we don't know when this will end, how long it will continue, and what the fallout of all of this will be.
how should families deal with the children, I mean, especially the small children, because they cannot venture out now?
Well, I think it is a real challenging thing to keep children occupied, especially young children who might be full of energy and want to do things. It actually depends on where you live, really, and what the arrangements for your living arrangement might be. So, for example, if you live in a housing society, there is a possibility that your society might have some timings when they allow you to go down with your kids to the lower garden or to play around downstairs. Now, clearly, you want to avoid children playing with other children because that's the whole idea of physical distancing. But there's nothing to stop you from going down and letting your child play something on their own, do something on their own. Keeping children occupied and busy and entertained is an extremely challenging task. And, it's going to test the limits of your creativity to try and come up with new things every day to ensure that kids are feeling entertained and engaged. At this time, actually, even for children, some routines are very good. So even if schools are not functioning, there's no harm in asking kids to actually continue with their studies, to spend a certain number of hours in their day studying, maybe keep a certain number of hours for television and some hours for playing or even on the computer. So I think having a routine is probably the most important thing with children. The second important thing with children is to try and explain to them what COVID means and what can happen, because kids might be frightened, they wouldn't know what is going to happen, and children will always imagine the worst. So it's important to explain to them in simple language what this COVID is about, who's likely to get it, who's not likely to get it, the fact that most people will recover, and all of these things that are anxieties for adults are also anxieties for children, and those need to be addressed. You need to do it in a language, depending on the age of the child, you need to do it in a language which they understand.
There are also general fear among, people. If someone, someone in the society tests positive for COVID-19, so I mean, all of the people who are living the society, they immediately, get concerned about this. How should they
Yes.
deal with?
Well, I think it's a completely unfounded fear. You need to first of all understand that you're not going to get COVID because there's somebody living in your society who might have had a COVID. Uh, to catch the infection, you have to be within touching distance of that person. If somebody is living in their own apartment and they are quarantined themselves into that apartment, then there is almost no chance that you are going to catch that infection. So it's an unfounded fear. It's based on panic, and it has no logic. It has no medical or scientific logic to it. So the most important thing to do is to actually check with the authorities what precautions they are advising. You'll have authorities which will know that, the medical authorities, the health authorities will know that this person has COVID, or they're quarantined because they might have come in contact with COVID. In which case, the health authorities will give you a set of instructions of what you should do and what you should not do. But almost certainly, unless you are in physical contact with that person, you're not going to catch COVID. So this is a fear which people need to just get out of their mind. They are not going to get COVID.
Thanks so much, Dr. Pathare, for talking with us. Thank you.
Yeah, thank you.